So here I have a dummy case to show you how the app works. But just maybe one thing before that, you need to know that the current version of the tool asks several mandatory questions which are related to our study and do not have a direct impact on the management of the clinical case. This means that the time to use the app takes longer than usual. Okay, so let's add this new patient. Jean-Michel, 4 years old, accompanied by his aunt, and he complains of ear pain. So those are the questions related to the study. Let me go rapid on that. We use directly the tablet. So his aunt does not know the exact birth date, but let's put something in the middle then. Again, questions related to the study. Male. And this is a self-referral. We don't know the name of his aunt. Okay. Now, this stage shows triage questions which, if triggered, prompt a message to the user to go to the emergency management page, in which we are building up this section where we give instruction to rapidly manage this emergency situation. For our case, there's no red flags. So this is the stage where we have the complaint categories. This means that's where we ask the user to probe also if there are any other complaints. In this case, there is only ear complaint. There's no fever, no respiratory complaint. This is basically the reason for the visit. So his weight is 16. And MUAC is normal. He has no fever. Those are measurements that may have been taken at the registration step. It depends on the setup of the health facility. So we have all the questions categorized under the systems for the medical history. No red flags, no convulsion. He is able to drink without problems. He did not have fever. Some cough, we discovered that. Barking cough, maybe we do not know what this means. We have an info button where we have an explanation. We can also add audio file, which will be eventually added to our tool. So no difficulty breathing, no barking cough, no hemoptysis. Cough lasted only since the morning. No sore throat, no runny nose, no neck mass. He only has ear pain, so he has ear problem. And then here we are prompted with several additional questions to further refine the diagnosis. Does the child has a discharge? And we discover that Yes, he has an history of ear discharge, and this ear discharge is acute, so less than 14 days. And he also has ear pain. No gastrointestinal problems, no significant exposures for tuberculosis risk, and no comorbidities. No significant weight loss. These follow-up questions are basically research related, so you can ignore those. They won't be shown in the final tool. So now we have the physical exam to perform. There's no conjunctival pallor, no palmar pallor. As he also has a cough, we will measure the respiratory rate. Let's see. Yes, we also have a link to a respiratory rate app so that we can help the healthcare provider in measuring that accurately. He has a normal respiratory rate for his age. He has no chest indrawing. The blood oxygen saturation is normal. He can finish his sentences without problem. There's no swelling pointing to mastoiditis, for instance. He has no cutaneous rash, no jaundice. The next section, it is the comment section where the healthcare provider can write down notes for this specific case. Let's leave it blank for now. In this section, we have tests. In now specific situation, the algorithm did not propose any test, but the user is free to add any test he or she deemed useful or necessary to perform. We will leave that empty. Then we get to the diagnosis page, where we have then the differential diagnosis which have been proposed based on the clinical data we entered. So we have an acute ear infection. We can also click on the info button to have more information. And here the app asks the user to agree or disagree with the proposal. Let's say that he agrees. Because of the weight, as you've seen, the Z-score had been automatically calculated based on the weight. So we categorize this child as having also moderate malnutrition. Because of the cough of acute onset, but without any other dangerous signs pointing to a pneumonia or a more severe condition, the app also proposed the common cold diagnosis. Here the user can also decide to add additional diagnoses which have not been proposed by the algorithm in this specific clinical scenario, but which are part of our basic algorithm. We will leave it that blank. The other option here is also to add free text if the user wants to add a diagnosis which is not part of the algorithm. Let's go to the treatment conditions. Here the app asks the user what are the drugs available, or maybe it may ask for other signs or symptoms just to further decide which is the best treatment for that condition. So if we were to say amoxicillin is unavailable, the app will propose the second line antibiotic. In this case, we have this antibiotic. Let's go to the medicine stage, where the user needs to go through all the drugs management and counseling proposed by the app for each diagnosis. For common cold, we are asked if we want to give paracetamol. Let's say that we will give that. We agree with that, and in this stage we do not have the exact dose because this will show up in the next section. I will show you shortly. These are generic informations. Then management and counseling, those are the information the app suggests the user to explain to the patient. For acute ear infection, then we also have paracetamol. We agree with that. And we have amoxicillin. We agree with that. Then we have also management and counseling information. We will go deeply in details on how these work in the next stage. For the moderate malnutrition, there are no specific drugs proposed, but the healthcare provider should give counseling on feeding, assess also the child's feeding, and there's no need for an urgent inpatient referral, but a follow-up in 13 days. We also have the opportunity to add additional medicine at this stage. Let's go at the final stage, where we will select the formulation and dosing for this case. The app has in its database the formulations available at that specific healthcare health facility. The route of administration, also the formulations are embedded in our tool and can be set up in Medal Creator. We will give tablets in this case. And for amoxicillin, the app will give the appropriate dose for the child based on his weight or his age. So in this case, if we have only the formulation for 125 milligrams per tablet, we will need to give 5 tablets. If the 250 milligrams tablet are available, we will give 3 tablet only. And if we have a liquid formulation, we have automatically calculated the exact volume to give. Let's say we will use the syrup. This section is only for research, so it won't show in the final tool when used in clinical practice, in routine clinical practice. I will quickly reply to all these. Then we go at the last step, treatments and management. In this section, we have the final summary of all the diagnoses proposed by the algorithm and also the drugs, managements and counseling suggested. The user at this stage can also use this page as an educational and training opportunity, and because we have those info buttons where there are more details on for instance here, why the inpatient referral is not needed. Also gives details on how to counsel the patient on when to come back if some symptoms worsen and things like that. And also we also have information on how to perform particular things like dry the ear by wicking. We can click on it and then we can have information on how to do it. This is an IT humor image. And this basically ends my demo of this tool. I hope you have enjoyed it. This basically ends my demo. I hope you have enjoyed it. Do not hesitate in asking us questions.